Hello, my name is Dr. Joseph Puccio, and I'm the Executive Director of Student Health Services. I hope everyone is doing well today, staying safe and relaxing. I want to spend a few minutes to describe the process that USF Student Health Services will be using to COVID-19 test students living in USF residential housing. Our testing will be different. The testing will be nasal testing, which means that the swab will go into your nostril only about an inch, and you will be doing it yourself. Before we go through that process, I need to let everyone know you must bring two things with you when you come to be tested. The first thing is your USF ID card, or if you do not have a USF ID card, a photo driver's license or a passport, as long as they have a photo. The second thing to remember to bring is hand sanitizer, which you will need to use after you complete the test. We will now begin to review the process to perform a nasal self-swab for COVID-19 testing. All students living in residential housing on the USF Tampa and the USF St. Petersburg campuses need to be tested before they can proceed to their room assignment. The only exception to this is if you tested positive for COVID-19 on or after October 21st, 2020. If you did test positive during this time frame, you will need to report to the testing site with a paper copy of your test results. If you have a medical issue that prevents you from doing a nasal self-swab when you check in at the testing site, please advise someone in regards to an alternative testing method. Okay, let's proceed to do our self-swab. After you check in at the testing site, you will receive a specimen bag with a covered test tube with a barcode on it, which will have all your identification. You will also have a swab that is located within a paper package. Remove the test tube from the specimen bag and place the specimen bag down. On the swab package, look for the separated ends and separate them, being careful to make sure the swab does not fall onto the ground. Remove the swab from the package by grasping the swab from the middle of the plastic part of the arm of the swab. Bend your head back about 70 degrees and place about 1 inch of the swab into your nostril or until you meet resistance. Once you meet resistance, do not push further. While in your nostril, turn the swab completely around 2 to 3 times, and then repeat the procedure in the other nostril. Once you completed swabbing, remove the swab from your nostril. Hold the swab in your hand. With your other hand, pick up the test tube, remove the cap from the test tube, place the swab into the test tube, break off the remainder of the swab at the notch, place the cap onto the test tube, place the test tube into the specimen bag, seal the specimen bag, then use hand sanitizer to clean both hands. Once this is completed, bring the specimen bag to the Student Health Services representative located at the table outside. The SHS representative will give you a paper to confirm that you completed testing. You can now proceed to your housing assignment. Thank you for your cooperation. Stay safe and go Bulls.